Painful sex after menopause? Here's the fix. Sex shouldn't hurt, but after menopause, painful sex from dryness, irritation, or tearing is extremely common. The problem is, too many women are told it's normal or that nothing can be done or go have a glass of wine. But that's not true. And today, I'll explain why painful sex happens in midlife and the solutions that really work. Hi, everyone. I'm Dr. Rebecca Hertel, family medicine physician and menopause specialist. And I can't tell you how many women I have coming to me in tears saying intimacy is painful and they feel hopeless. But here's the good news. There are highly effective treatments and you don't have to give up on intimacy. So why painful sex happens? Estrogen decline. This can lead to vaginal dryness, thinning, and loss of elasticity. We call this the Genitourinary Syndrome of Menopause. Reduced blood flow. This can affect arousal and your lubrication. There could be issues with pelvic floor, such as weakness or tightness, and this can contribute to discomfort as well during intimacy. What about delayed care? Many women wait years before seeking help. And guess what? Your practitioners are not going to ask you the questions. There is a disconnect between what practitioners are asking their women about their intimate lives. What doesn't help? Using nothing at all. Friction can make this worse, leading to horrific pain, tearing, abrasions, pelvic floor dysfunction, relying on lube alone without addressing the underlying cause. It will never get better, and you will eventually would just stop being intimate with your partner in that way, being told it's just a part of aging. No one should ever take that as an answer because it can be treated. What does work? Lubricants and moisturizers, vaginal estrogen. Those are first line. The creams, the tablets, or the rings, those completely can help restore the tissue health. And then you can add those vaginal moisturizers and lubricants onto it. You may still need them. They may make intimacy a lot more comfortable for you. Non-hormonal options, DHEA, Ospemifene are two options. There are some controversial data on laser therapies in some cases. Pelvic floor therapy. We love our pelvic floor therapists. That can completely improve comfort, function, get you used to using that pelvic floor in the way that you're supposed to, whether it be by learning to relax the pelvic floor or tightening up the pelvic floor. Lifestyle, staying sexually active as long as it's not hurting. With or without a partner, solo intimacy is completely fine. Once those tissues are back to normal, that'll all help improve blood flow and tissue health. So one of my patients hadn't had pain-free intimacy in years. And after just a few weeks to a month of vaginal estrogen, pelvic floor therapy, she felt like she got her body back, her intimate life back. And that's the power of treatment. Painful intimacy after menopause isn't something you have to live with. There are safe, effective treatments that can restore comfort and pleasure. You deserve intimacy without pain. If this video helped you, hit subscribe and share it with a friend. Far too many women suffer in silence. Stay tuned for the next video because midlife is about thriving and not just surviving.